Dear students, the topic for this video is non-depolarizing neuromuscular blockers. The specific learning objectives are classification of the skeletal muscle relaxants, mechanism of action of non-depolarizing blockers, mechanism of action of non-depolarizing neuromuscular blocking drugs, pharmacological actions and adverse effects of non-depolarizing neuromuscular blocking drugs, and therapeutic uses of non-depolarizing blockers. Seeing these pictures, you have any idea, you got any clue about what I am going to talk about? So these are tribal peoples, and you can see a plant and a few arrow poisons. So I am going to talk about the history of neuromuscular blockers. So going back to the history, the South American tribal people, they were in the Amazon forest, they used these arrow poisons, that is the curare, for killing the animals, that is for hunting the animals for food, as well as against the enemies. They used these curare as arrow poison. The active compound in this was a D-tuberculare, and it has got a major influence on the practice of anesthesia and surgery. So when they use this arrow poison, these arrow poison, that is the curare, what is present in the arrow poison, they can paralyze the skeletal muscle in the animals and thereby causes respiratory paralysis. So which can lead to the finally can lead to the death of the animals because of the respiratory failure, but no harm in eating those the killed animals, because once there is the GIT also, it is not absorbed. So without any harm, they can eat those 100 animals. And because of the standardized preparation that was not available, lack of purity, and there are no convenient techniques of mechanical ventilation if overdose occurred. Because of all those limitations, it has been until 1942, it was not in the medical practice. About the classification of the skeletal muscle relaxants, the types are competitive non-depolarizing blockers, non-competitive depolarizing blockers, directly acting muscle relaxants, centrally acting muscle relaxants, and miscellaneous, that is the aminoglycosides. So in this, I'll be dealing with in this video, I'll be mainly covering the non-depolarizing competitive blockers. So they are classified into long-acting, intermediate, short-acting, and ultra-short-acting, peripherally acting skeletal muscle relaxants. So long-acting is pancuronium, pipocuronium, doxycurium, vecuronium. Intermediate is rocuronium, atricurium. Short-acting is mivacurium, rapacuronium, and the ultra-short-acting is gantacurium. So this is how the non-depolarizing competitive blockers is classified. So about the structure of the neuromuscular blocking drugs. So this has got a structural resemblance to the acetylcholine. So succinylcholine, it's originally called diacetylcholine, and it has got two molecules of acetylcholine which is linked through an acetyl methyl group, and the pancuronium, that is another competitive blocker which has got two acetylcholine like fragments oriented on a steroid nucleus. So these agents has got one or two quaternary nitrogens, which makes them more lipid soluble and limits the entry into the CNS. So it doesn't penetrate the blood-brain barrier or doesn't have any effect on the central nervous system. So coming to the mechanism of action of this competitive blockers, they bind to the nicotinic receptor. As we all know, the acetylcholine binds to the nicotinic NM receptor in the neuromuscular junction. So this competitive blockers or the non-depolarizing blockers also bind to this nicotinic receptor, where exactly it binds to the alpha subunit. So which is that alpha subunit? This is the place where the acetylcholine binds, isn't it? So these neuromuscular blockers, that is the competitive non-depolarizing blockers, they bind to the alpha subunit where the acetylcholine binds. So binding to that acetylcholine binding site, it prevents acetylcholine from binding. It competes with the acetylcholine in binding with that particular alpha subunit. Okay, so D-tubocurarin go and binds to that alpha subunit where acetylcholine binds. So what happens? There won't be opening of the sodium channels, isn't it? So no depolarization. So that's how these non-depolarizing blockers act. Because of the competitive nature, as I told, the postsynaptic blockade, you can reverse that. Okay, that can be achieved by increasing the acetylcholine levels at the synaptic cleft. So at the synaptic cleft, you can increase acetylcholine level. How? That is by giving the cholinesterase inhibitors, or otherwise we call it as anticholinesterases. About the pharmacological actions, the muscle weakness, which can lead to the flaccid paralysis in the muscles. So as we see the order of the muscles affected, how the muscles are getting affected. So the extrinsic eye muscles, muscles of the fingers, neck muscles, face, hands, feet, trunk, respiratory muscles, mainly the intercostal and the diaphragm will be affected last. So this is the order how it is affected. And recovery that occurs in the reverse order. So the respiratory muscles will get relieved of the paralysis first, okay, then the trunk. So in the reverse order, it will get the reversal occurs. And the patient doesn't lose consciousness, appreciation of the pain is not affected. So that's the reason it is given along with the general anesthetics. About the pharmacological actions of this competitive blockers. So they blocks the nicotinic NN receptor, which is present in the autonomic ganglia also. So it produces ganglionic blockade. Another another property or the action of this older agents like D-tubocurarin is the histamine release. It releases the histamine. In the cardiovascular system, there will be a significant fall in BP. Why there is a significant fall in BP? It's because of the histamine release. There will be vasodilatation which causes fall in BP. Increase in heart rate. So increase in heart rate, the effect on the blood vessels. Effect on the blood vessels is because of the histamine release, the ganglionic blockade, okay, and the vagal effect or vagal ganglionic blockade, which can causes an increase in heart rate also. And this is not seen with this newer competitive blockers. So newer competitive blockers has got negligible effect on the histamine release, blood pressure and the heart rate. Other actions are like in the GIT, that is a post-operative paralytic alias, that is this is also seen because of the ganglionic blockade. And no central nervous system effect. It doesn't crosses the blood-brain barrier. Why? Because of the poor lipid solubility, no effect on the central nervous system, doesn't cross the blood-brain barrier. What are the adverse effects seen? Adverse effects are like hypotension, tachycardia, respiratory paralysis, bronchospasm, and this bronchospasm is mainly seen in the sensitive individuals who are very sensitive, and even the hypotension also this is seen in the patients who are very sensitive, and the aspiration of the gastric contents. So these are the adverse effects seen with this competitive neuromuscular blockers. Coming to the pharmacokinetic part, it should be given by the parenteral route. So most preferred route is intravenous, and occasionally it is given by intramuscularly also. It is poorly absorbed orally. One of the reason is I told no quaternary compound it is not absorbed. That's the reason it is not absorbed orally. Poor lipid solubility, that is another reason. So because of the poor lipid solubility, it doesn't cross the blood-brain barrier also, and generally excreted unchanged. And one important thing you have to remember is about the atrocurium. It undergoes Hoffman's elimination, that is a non-enzymatic degradation, okay, and even some amount is getting degraded by the pseudocholinesterase also. So what are the advantages of the synthetic newer competitive blockers? Less histamine release, so no bronchospasm, no allergy, nothing, and doesn't block the autonomic ganglia. So ganglionic blockade effects won't be there. Spontaneous recovery with most of the drugs, because most of them will be having a rapid onset and short duration of action. Then rapacuronium and rocuronium, they have got a rapid onset of action and even the short duration. So it is used for the endotracheal intubation procedures and all. These are the drugs which is preferred. Next is the mivacurium. Mivacurium is the shortest acting, which is also metabolized by the butyrylcholinesterase enzyme. So atracurium, it is the choice of the drug in patients with poor renal and poor hepatic function. Why is it so? Because atracurium, if you give also, in such patients, the plasma half-life is not prolonged, whereas with other drugs, the plasma half-life will be prolonged. So that's the reason you can't give other competitive blockers, non-depolarizing competitive blockers in renal or hepatic patients who are having any poor renal or hepatic function. But you can give atracurium, that is the choice of. Now, what are the therapeutic uses of non-depolarizing blockers? These are used as an adjunct to general anesthetics. Why? For producing the satisfactory skeletal muscle relaxation. For the proper or for the smooth surgery to proceed, you want a proper muscle relaxation. So that's the reason as a pre-anesthetic medication, this non-depolarizing blockers are given along with the general anesthetics. Next, for facilitating the endotracheal intubation, especially the rocuronium or rapacuronium is preferred due to the rapid onset of action. Short procedures and all, this is the one which is preferred for the endotracheal intubation. Then control of ventilation, especially in patients who are critically ill patients who have got ventilatory failure, who has got bronchospasm or pneumonia. In such patients, to control the ventilation and to provide the acute gas exchange and to prevent the atelectasis, it is given. Then to reduce the chest wall resistance and also to decrease the oxygen utilization and to improve the ventilatory synchrony. So these are the uses of the non-depolarizing blockers. So this is just a summary. So here where I started this history, okay, arrow poison of indigenous by the South Americans. Then about the structure I have mentioned, okay, Detobucurarium, pancuronium, and how they act, they by blockade of this nicotinic receptors and no depolarization of the end plate, which can lead to the relaxation of the skeletal muscles. And where it is used, where you have to give the artificial ventilation along with the general anesthetics, okay, and the specific antidote. So about this, the reversal of the neuromuscular blockade, I'll be covering in the next video. So that's all about the non-depolarizing competitive blockers. So students, thank you.